Hello folks, we are the moderators from UKPHR for Specialist Registration by Portfolio. My name's Judith Hooper and
I'm Carol Wood.
And the purpose of this podcast is just to give folk an overview of what's entailed in registering by portfolio with UKPHR. So the overview of the process is that there are two stages, a pre-application stage and then to a submission of the portfolio for assessment. Why do we have a pre-application stage? Well, in our experience of the previous version of registration by portfolio, where we didn't have this pre-application stage, a number of applicants sent in a portfolio and it was clear that A, they didn't have the range of experience and knowledge across all the competencies, or B, they were not working at the right level for all the evidence that was needed. So we have this pre-application stage. There's a lengthy form to go through, and it has two assessors who then report their decision to a peer group of assessors at a meeting called the registration panel, which meets every month. The assessment decision is discussed at that panel, and one of us is always in attendance to quality check any issues that may arise from our reading of their decision. There's then a final decision by the applicant. If you've passed the pre-application stage, you've then got 18 months to submit your portfolio. If you're not accepted at pre-application stage, you can reapply after 6 months, and a feedback call is offered with your assessors. The portfolio also has two assessors who are different to the pre-application stage, and their assessment may ask for clarifications, i.e. to produce a bit more evidence in terms of what you've submitted, or a resubmission of new pieces of work to provide adequate evidence. And both of those, there's a 6-month return time. 3 assessments of the portfolio are allowed, and if all 3 fail, then the applicant has to restart the pre-application process again. There are 2 other results. One is the portfolio is deemed to be unaccessible, and this means the navigation's wrong or the evidence is too poor throughout the portfolio, and that will mean that the applicant has to resubmit the entire portfolio. The final outcome is a complete return, and that means, again, the applicant has to wait a period of time, because the reason for a complete return would be a perception that the person's not working at the right level at the pre-application, but that should have been sorted out. So essentially, portfolio, 2 assessors may ask clarifications, resubmissions. You have 3 goes at portfolio. If you fail that, restart the process, and one of the outcomes may be unaccessible, which means you need to resubmit the whole portfolio. Over to Carol.
So I want to say something about the documents that you need in order to undertake this process. They're all on the UKPHR website, and if you go to the I Want to Register website, it's all under the Specialist Registration by Portfolio Assessment route. And in that, you need to read the text there and actually follow the links to all the different documents. So there's a separate section for stage 1, which is the pre-application guidance and documents, and then a separate section for stage 2. But you must check that you've got all the documents that you need, and they are the most up-to-date ones. But we do recommend that you read the guidance thoroughly, and we say this over and over again, because very often we do get asked questions, and a lot of the answers to those questions are in the guidance. So we're constantly upgrading the guidance just to make sure it's clear. The rules don't change very much. It's just that we try and make sure the guidance is as clear as possible based on our experience of actually running this program. It's really important that you become familiar with the competencies. The UKPHR Specialist Registration competencies are both know-hows and show-hows. These competencies are based on the 2015 Faculty of Public Health Specialty Training Programme curriculum, and they've been redrafted for retrospective assessment. Those competencies were updated and published by the Faculty of Public Health in 2022. So it's actually worth having a look at those, because you'll be able to see how the UKPHR competencies were derived. If you are approved to present your portfolio, you've got 18 months to do that, as Judith said, and then you need to refer to specific guidance for preparing your portfolio, and look out for some future podcasts, which hopefully will give you some tips and more information. It's quite important that you find yourself some support if you are writing your portfolio. You may find there are people around in the system who actually went through the defined specialist route, the previous registration route. The actual writing of a portfolio for this specialist registration by portfolio route is not really that different to how people were required to produce the portfolios for the previous route. It's just the competencies that are different. And it is an art to learn how to write a portfolio, very much focusing on the competency. And there's plenty of guidance on that. And we'll be doing a future podcast on that. So make sure you really get that support from someone who's been through the process, and tap into any support networks that are available to you locally, because there's a lot of little pitfalls and a lot of tips that you can be given just to help you successfully write your portfolio. I think that's probably what we wanted to cover in this introduction podcast. Applicants that have done the pre-application do generally find it's a positive experience. The UKPHR competency framework is really useful as a framework in which to develop your practice. So many people come into public health with a particular background and have to develop in certain areas in order to achieve the full breadth of competencies. So just a final reminder to look at the guidance and become familiar with all the documents on the website. There'll be separate podcasts on other parts of this process.
Thanks very much.
Thank you.